Wildfire smoke isn't just a threat to communities in the path of the flames. Smoke can travel hundreds, even thousands of kilometers, affecting air quality far from the fires themselves. This week, parts of Ontario recorded some of the worst air quality in the world, prompting Environment Canada to issue widespread warnings for much of the province. While the haze may come and go, health experts warn of the long-term effects that come with the smoky exposure, especially to our lungs. Joining us now to help us understand those risks is Dr. Vaibhav Gupta. He's a chief medical advisor at the Lung Health Foundation and a thoracic surgeon. Thank you for joining us today.
Thank you for having me, Jazan.
So firstly, just very briefly, what is it about wildfire smoke that makes it so harmful? What exactly are we breathing in?
There's so many components to the wildfire smoke. This week we saw such interesting and scary colors in the sky because of all the fine particulate matter that's in the smoke. But there's also harmful gases, including ozone, sulfur dioxide, nitrogen dioxide, and methane, among other gases that impair our ability to get oxygen and breathe efficiently and are causing these symptoms that we've all been experiencing.
Okay, and we often hear that, older adults or people with asthma or other lung conditions are most at risk. But what about otherwise healthy people? Should repeated exposure be a concern?
Absolutely. This can really affect all of us because all of us are susceptible to the inflammation and to the airway reactivity that this kind of smoke causes. Not only when we can see it the way we have been able to this week, but when we can't see it, but we know that wildfire is occurring around us. And that's why we really have to be aware of the air quality index that's reported so that we can take appropriate precautions and keep ourselves safe.
Okay, and many people still have to be outside for work or other responsibilities. What practical steps can they take to reduce their exposure rather, and protect their lungs?
Those of us who have to be outside, if we're traveling in a car, we really want to keep our windows closed, make sure that the air is recirculating within the car so that the air filter can take care of it. And those of us who are walking outside, ideally wearing a mask, an N95 or a KN95 mask to filter out those fine particles and keep ourselves as safe as possible.
Okay, and parents are understandably worried about their children. How does wildfire smoke affect kids differently than adults?
Kids' lungs are still developing and they don't have all of the host defense mechanisms that a fully developed immune system has. So this is an opportunity to educate the kids, to plan indoor activities, to limit their exposure outside, and keep an eye on their health because they can't always tell us how they're feeling. So we're looking for subtle symptoms in kids, change in behavior, change in mood or attitude. And in all of us, we're looking for chest tightness, difficulty breathing, coughing or wheezing, and the irritation that we're noticing in our throats or in our eyes. Those are some of the subtle symptoms that we are being impacted by the wildfire smoke.
Okay, and when it comes to being inside your home, what can people do to improve their air quality?
Really important to make sure that your furnace air filter is up to date because that can really take care of a lot of the particulate matter. For anybody who's in a vulnerable group or particularly noticing symptoms, you can get a portable air filter with a HEPA filter. Again, that can really improve air quality. And finally, very important to avoid smoking or vaping or lighting candles indoors. Those are, in fact, some of the worst drivers of indoor air quality. So when outdoor air quality is so poor, we want to maximize our chances of being safe indoors.
Okay, and finally, experts say climate change is making wildfire seasons last longer and more intense. So from your perspective as a doctor, are you seeing more smoke-related respiratory issues than you were, let's say, 3 years ago?
Just yesterday I had a patient call my office, somebody who I removed part of the lung for and has been having some difficulty breathing over the last 3 to 4 days and was wondering whether it's related to underlying COPD, but really is probably triggered by these wildfires and the smoke that we've been having. So We are starting to see increased presentations to the emergency department, increased admissions to hospital. We've had some data from recent wildfire seasons in Ontario and in Canada showing that. So it does make me concerned that if this sort of situation continues, then it's going to have short and long-term effects, not just on our lung health, but on our heart health, and our brain health, and our health in general.
All right, Vaibhav, thank you so much for your time and insight today.
Thank you for having me.
That is Dr. Vaibhav Gupta, Chief Medical Advisor at the Lung Health Foundation.